Hello everyone. The next developmental disturbances affecting oral and paraoral structure, that is the developmental disturbances in size of the teeth, that include your microdontia and macrodontia. When we discuss about the developmental alterations in the size of teeth, that is the tooth size is variable among different race and different sex. So the presence of unusually small teeth or unusually larger teeth. If the teeth size is smaller, then it is known as microdontia. Okay, teeth which are not smaller than the normal, that is a microdontia. It can be of three types: true generalized microdontia, relative generalized microdontia, or localized, that is the microdontia involving only a single tooth. Coming to etiology or the causative factor for microdontia. Why the tooth size becoming smaller? Although heredity is a major factor, both genetic and environmental influences also affect the size of developing teeth. Then coming to the deciduous dentition or the primary dentition and the permanent dentition, because microdontia affecting both the primary and the permanent tooth. So the deciduous dentition appears to be affected more by the maternal intrauterine influences as compared to the permanent teeth that to be more affected by the environmental factor. Then first is true generalized microdontia. Generalized means it affecting two or more teeth. In the picture you see there are involvement of more than one teeth which are smaller in size. There is a diffuse microdontia, generalized or diffuse microdontia. This is the dentition in which the teeth are smaller than normal and widely spaced within the arch. Okay. These microdontia showing all the teeth are smaller than normal, and its occurrence in some case of pituitary dwarfism. That is because of the pituitary hormones, in dwarfism patients it shows microdontia. So the teeth are well formed but smaller in size. Next one is relative generalized microdontia. There is normal or slightly smaller than normal teeth are present in jaws that are larger than normal. In this case, teeth are smaller as well as the jaws also larger than the normal, and there is an illusion of true microdontia. Since it is well recognized that a person may inherit the jaw size from one parent and the tooth size from the other parent. So the role of hereditary factors in producing such a condition. So it produces an illusion of true microdontia. The third variation is microdontia involving a single tooth. Most often affects the maxillary lateral incisor and the third molar. These two teeth are congenitally missing. One of the most common forms of localized microdontia is it affects the maxillary lateral incisor, that is known as peg lateral. In the picture you see the lateral incisor, there is a microdontia. This is not the normal lateral incisor size. So this is the isolated microdontia or peg lateral. This is small cone shaped right maxillary lateral incisor. In this, the normal, parallel or diverging mesial and distal surface is not there, and the sides they converge or taper together incisally, forming a peg shaped or cone shaped crown, that is known as peg shaped lateral or peg lateral. So next, developmental disturbances affecting the size of tooth, that is macrodontia. Macrodontia is the opposite of microdontia and it refers to teeth that are larger than normal. Then it again classified into true generalized macrodontia, relative generalized macrodontia and macrodontia involving the single teeth. First is true generalized macrodontia, the condition in which all teeth are larger than normal and it has been associated with pituitary gigantism. This is the opposite of microdontia. In microdontia, that is a true generalized macrodontia associated with pituitary dwarfism. In case of macrodontia, it is associated with pituitary gigantism, though this is extremely rare. The second variant, that is relative generalized macrodontia, it is somewhat more common and it is a result of the presence of normal or slightly larger than normal teeth in small jaw. That's showing also a illusion of macrodontia. Then macrodontia of single tooth. That is relatively uncommon but it's seen occasionally with unknown etiology and the tooth may appear normal in every respect except for its size. So sometimes the true macrodontia of a single tooth is confused with fusion of teeth. A variant of this localized macrodontia is the type that is occasionally seen in case of hemihypertrophy of the face, in which the teeth of the involved side may be larger than the unaffected side. So that is the variant of localized macrodontia seen in hemihypertrophy of the face. So these are all about the developmental disturbances affecting the size of the teeth. It may be smaller, it may be larger. Based on that, it can be classified into microdontia and macrodontia. Again, microdontia classified into true generalized macrodontia, relative generalized macrodontia and microdontia involving a single teeth. Like that, it again classified in macrodontia also. I hope you understand this video and like and subscribe to this channel. Thank you so much.